Going to the doctor no longer means going to the doctor. Telehealth means we can get a lot of medical care from the comfort of our homes.
Yes, it does, but as KSL consumer investigator Matt Gephardt found, fraudsters have noticed. Matt?
Yeah, that's right, Mike. Dini, going to the doctor anymore largely means going through our computers or our cell phones. It's become the norm. The benefits are vast. They are well documented. But as we found, there are some real-world costs, too.
Before COVID struck, Medicaid and Medicare only reimbursed providers on many tests and procedures for in-person visits. Telehealth visits were not acceptable back then, but they are now, and the bad guys have caught on fast.
It created a huge opportunity for fraudulent activity.
Hayward Talcove is the CEO of LexisNexis Risk Solutions Government Division. His group has been digging into Medicaid billing records, and in numbers shared with the KSL investigators, they found nationally $4.5 billion in taxpayer money has already been pocketed in fraudulent telehealth schemes. And the Utah Department of Health confirms it is an issue in Utah, telling the KSL investigators, quote, "We follow the national trends."
You saw just a huge uptick in the use of stolen information to perpetrate fraudulent activity by providing services that were never provided.
Talcove says the crooks use stolen identities of both providers and patients, living and deceased, to bill Medicaid for telehealth visits that never actually happened. Some schemes are difficult to detect, others are pretty easy.
That person's working 23 hours a day, doing 8 appointments an hour, and not even taking a break. What a dedicated provider.
Besides their identities being used, patients could face denials of benefits somewhere down the road.
You could find yourself in Medicaid prison because it's going to appear that you're getting services inappropriately and not following the rules.
The solution? Talcove says Medicaid agencies need to do better data analysis. Utah, for its part, says they are, telling KSL, quote, "We are working with federal agencies to ensure we stay on top of any emerging fraud trends."
And here's a specific fraud that we found is targeting consumers. People are getting phone calls saying, hey, we've done a little COVID tracing and we've seen that you've been around somebody. Call into one of our telehealth providers because we need to ask you some questions. Those questions have to do with your credit card number and other personal information. Turns out it was just an identity thief trying to make off with personal information. If you got something you want us to investigate, let us know about it. The number 385-707-6153, or you can email me, matt@ksl.com.
All right, good stuff there, Matt. Thank you.